ABS Radio. Member, kapisanan ng mga broadcaster ng
After an intense
Pilipinas.
workout, many of us may experience sweating a lot. Sweating is part of your body's way to adapt to your core body temperature. But for others, this can be a regular occurrence even without physical activity. It's called hyperhidrosis, and it can trigger anxiety and embarrassment for those who experience it. On the program today, we'll talk more about this condition, why it happens, and how best to manage it. I'm Dr. Freddy Gomez, and welcome to Medtalk Health Talk on CNN Philippines. If you experience constant sweating even without anything triggering it, you might have a condition called hyperhidrosis. Our guests are here today to tell us more about this. With us is Dr. Melissa Pasion Dabao. She is the chairman of the Department of Dermatology at the Asian Hospital and Medical Center. We're also joined by Dr. Allen Aguinaldo Cabrera. She is a procedural dermatologist from the Medical City. We sweat when we feel hot, when we walk, or even when we eat spicy food. Now, it's a normal and actually a necessary part of our life. Now, I'll start the conversation first with Dr. Melissa. Tell us more about the importance of sweating.
What's important is we have to maintain our body temperature. So we have a core body temperature. So if ever there's a discrepancy in it, if it's too high or too low, our brain will signal something to our body that we have to maintain it. If that happens, that's if the body temperatures increase, so the brain will tell us to lower it down. That's why we sweat. And if ever naman it's too high, you'll have shivering when you feel cold.
So sweating is actually part of the normal process of our body in order to keep our body temperature at its optimal temperature. When we feel hot or during exercise, our muscles heat up, so we perspire even more. Now, Dr. Allen, what would happen if we didn't sweat? Is there a condition actually that preempts a person to not sweat at all?
There are instances wherein there's a buildup of increased temperature. And so if there is increased temperature, there is what we call the heat stroke. First, it starts with heat fatigue, wherein there's increased temperature and there's beginning a CNS dysfunction and later on collapse. No?
Just as not sweating would pose some problems, too much sweating can have some effects on our body as well. Dr. Melissa, let's talk about hyperhidrosis, the true definition of this. How does this differentiate to someone na pawisin lang, who just sweats a lot?
We have 2 to 4 million sweat glands, no? So they're saying we produce sweat like 10 liters a day. So that's the normal. Now for excessive hyperhidrosis, as they call it, excessive sweating, and which will disrupt this, what is physiologically necessary to maintain the core temperature, that's what they term it as hyperhidrosis.
Now, Dr. Allen, are there several types of hyperhidrosis? Could you tell us the difference between these?
There is what we call the primary hyperhidrosis. It occurs during childhood and it's genetic. It has a strong family history. And so usually it's aggravated by emotional stimuli if they feel embarrassed, and usually occurs on the palms, the soles, the axillary area. Now the secondary is actually attributed to medications that are given, for example, antipsychotic drugs or even antidepressants. Now that will also trigger excessive sweating. And so under the secondary is the systemic disorders like diabetes or even hyperthyroidism or tumors like lymphomas and pheochromocytomas. Now, all these kinds of tumors can also attribute to excessive sweating.
Which one is the more common one to happen, especially here in the Philippines? Is it the primary or the secondary type?
It's really the primary, and most of us dermatologists, we only see localized hyperhidrosis, particularly on the armpits, no, the axillary area, or sometimes or the palms and the soles.
Now, Dr. Melissa, talking about the primary hyperhidrosis, aside from sweating a lot, and we'll talk about some of the social impact of this later on, but meron bang masamang nangyayari sa katawan kapag napapawisan tayo ng sobra-sobra?
The problem that I see is really more the quality of life and the severity of the hyperhidrosis, how they affect how they work or their social interaction with people. That's really more the problem for the patients, especially if they have excessive sweating.
Please tell us more about this. How so is the quality of life changed, Dr. Melissa?
Yes, actually, I have patients, especially in the corporate world, where they really have to wear corporate attire. And if they have excessive sweating, especially on the axillary, it really bothers them. And to the point that some people, they don't also go to work. So that's why they consult us if we could address that problem.
Dr. Allen, are there beginning symptoms of someone with hyperhidrosis?
When they get embarrassed or frustrated or stressed out, it comes out usually on the upper lip, the axillary area, the palms, and the soles.
Now, Dr. Allen, with excessive sweating from hyperhidrosis, are there other symptoms from the body, excessive odors? Does this follow as well?
Yes, especially on the axillary area because these are occlusive areas. And then later on, if it's very occlusive and there's so much sweating, it's also prone to fungal infection, no? That can also smell, no? Like we have the tinea pedis, the one on especially on the toe webs or in the axillary area.
Now, there are some factors that might make you more vulnerable to the condition. Now, we'll discuss these causes when we return. And later on in the show, we'll talk about how people living with this condition can best manage the physical as well as the mental challenges that come with it. Keep it here on Medtalk Health Talk, only on CNN Philippines. I'm Dr. Freddy Gomez and welcome back to Medtalk Health Talk on CNN Philippines. When we sweat, it keeps our body cool as it evaporates from the skin. So it's actually part of the normal process of our body which keeps us healthy. If we didn't sweat, we'd overheat. But there's such a thing as excessive sweating even without much physical activity or hyperhidrosis, and it can affect a person's physical as well as their mental health. Now, Dr. Melissa, let's talk about the mental aspect of this. So for someone with hyperhidrosis, you mentioned an example earlier of on the corporate world, it's somewhat unnerving to be sweating at different forms, especially in meetings and whatnot. Since the primary hyperhidrosis mainly occurs in the armpits, the face, the soles, the palms, mainly emotional areas when we sweat, as what was mentioned earlier by Dr. Allen. Is there an emotional component to this? Can someone who is excessively anxious have hyperhidrosis?
Actually, that's one of the causes of the primary hyperhidrosis because of stress. Unlike the secondary hyperhidrosis, which there is an underlying medical condition. So that differentiates the two. So stress can really cause sweating. But in order for you to say that there is hyperhidrosis, there's like a criteria that at least you should have hyperhidrosis for at least 6 months. And then they experience hyperhidrosis like once a week. And it really affects their quality of life.
Now, Dr. Allen, ang taong tinatawag na pasmado, is that a case of hyperhidrosis?
Well, in layman's term, yes. Kasi that's our usual way of saying na pasmado, they have hyperhidrosis palmoplantar or on the palms, no? So they say they're pasmado because they have wet hands.
Let's talk about one of the main focuses of this, which causes the undue embarrassment when they're in social situations. Dr. Allen, does hyperhidrosis happen 24 hours a day, 7 days a week to someone who is affected by it?
Actually, there will be certain instances, maybe several times a day or maybe at night. So it depends on the condition, but it's usually they're awake. It's an emotional stimulation, they're awake. It doesn't really happen when they're, sleeping. So that is for secondary naman. But for the primary, the interesting to note is they're always awake and there's an emotional stimuli that will actually activate the sweating process.
Dr. Melissa, when it comes to primary hyperhidrosis, it can happen early on in children. And of course, this can be very unsettling, not just for the child who is affected by hyperhidrosis, but for the parents as well. Now, for a parent who may think that their child may have hyperhidrosis, is probably being teased, bullied in class, what advice can you give to the parent? Is this something that their child will grow out of over time, or will it just progressively become more and more evident?
Hopefully they could consult us because there's really a treatment that we can help them with, no? Even like a topical, like for children, we can just apply like aluminum hydrochloride as one of the treatment. That's like a baseline that you can let them try.
Dr. Melissa, when it comes to children who might be affected by this condition, what are some of the signs that the sweating that they are experiencing is not just normal sweating, but it is already hyperhidrosis?
Now you have to really differentiate, as what we explained with Dr. Allen. There are really two types, no? The primary and the secondary. So if you try to see first if it's because of stress, that you can categorize that as primary. But if you can see other from the medical history by just talking to the child and you can see other signs and symptoms, then you try to consider there might be actually a secondary problem. There might be underlying medical illnesses, like for example, thyroid. Then you try to look away from the hyperhidrosis and try to see a medical problem that can actually cause the sweating.
Dr. Allen, when it comes to the correct diagnosis of hyperhidrosis, is a proper history and physical exam enough, or are there actual tests that measure the amount of sweat being released that determines someone to have primary or secondary hyperhidrosis?
For the primary, there is a certain category, more than 6 months, and then there's always profuse sweating, especially on the axillary area. And then there is what we call the iodine starch testing. But then I don't really, it's purely medical and the history. No? I base so purely medical and the history. And then if you have any suspicions on medications or current medications or the medical history, then we can start doing laboratory examination just to test if there is diabetes or, as what I've mentioned, hyperthyroidism that will be causing the profuse sweating.
So excessive sweating from hyperhidrosis can lead to a lot of serious problems, especially with your confidence when in a social setting. More on this when we return. Your health is our mission here on Medtalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and this is Medtalk Health Talk on CNN Philippines. The effects of hyperhidrosis or excessive sweating run more than skin deep. They pose a number of health risks or health issues, especially mental ones. But more than that, anxiety and depression affect those who may have it, and it can interfere with their quality of life. Dr. Allen, let's talk about now how best to manage a situation like this. We were talking earlier about stress as being the number one factor here. What is the main approach when it comes to someone who is affected with hyperhidrosis? Is it medication right away, or are topical treatment best first-line treatment here?
We start with the conservative treatment. Number one is the topical treatment, as what mentioned earlier by Dr. Dabao. If it does not work, then we can go into oral medications. And then my best treatment really, if especially in adolescents or more adult patients, is really intradermal injection of botulinum toxin. I'm very happy with this because it has dramatic effect, and usually it's kind of painful though because there's pricking sensation or the needle sensation. So we usually put a numbing cream few minutes before we do it, and then we inject. Now usually there's 80 to 90% no sweat, and it usually is maintained for about the longest is about 16 months.
How many sessions will it normally take to have acceptable results?
It's usually one time, actually. Usually on the third day, they start feeling that there's really no sweat.
Is there a drastic change in the quality of life for your patients who have undergone the botulinum toxin injections to control their excessive sweating?
Yes, especially when those people who are in the media, sometimes when they put up their hands and there's like a sweat patch, it makes them embarrassed, especially in the national TV, So what they do is they have this and they feel very confident, even with, let's say, doing aerobics and all that, there's really not much patch on the armpits.
Now, Dr. Melissa, when it comes to lifestyle changes, are there changes in a person's diet or maybe daily activity that can affect or lessen the amount of hyperhidrosis that they may encounter?
I think it's more living a stress-free life that will decrease your hyperhidrosis than connection with food. But if ever, not unless the bromhidrosis, which is like an offense body odor, sometimes there's like a connection with food, like eating spicy food or curry and garlic.
Before we go, do you have any advice for our viewers who might be contemplating or maybe they do have hyperhidrosis and would like to seek treatment? I'll start first with Dr. Melissa.
Of course, if it becomes very bothersome and it actually affects the quality of life of the patient itself, especially children, they should definitely consult certified dermatologists to help them address their problem.
Dr. Allen, do you have any message for our viewers?
For those people suffering hyperhidrosis, profuse sweating, you have to seek consultation so that we can help you, so that there will be no embarrassment to spare you, so that we can give enough advice and to have a better quality of life.
Then thank you so much for enlightening us on how to determine if someone does have hyperhidrosis as well as its types. Thank you so much, Dr. Melissa Pasion Dabao and Dr. Allen Aguinaldo Cabrera, for being with us today and sharing your expertise about this. And advice to our viewers, always seek your consult from a board-certified dermatologist. I'm Dr. Freddy Gomez, and thank you for watching Medtalk Health Talk. We'll see you again next time.